You've shared some really fascinating insights with us before about shifts in healthcare. And today, on the deep dive, we're really dissecting one of the biggest, India's push for, well, a pretty groundbreaking change. We're exploring the nation's very first integrated MBS BAMS course. It's set to launch at Japarin in Puducherry, a really prestigious institution.
That's right. And it's more than just, a new course listing in a catalog. This is really a significant cultural and scientific pivot. The aim is to weave together modern allopathic medicine with ancient Ayurvedic wisdom.
Exactly. So our mission today is to unpack the nuts and bolts of this initiative. Why is it such a huge step? Why now? And we'll definitely get into the, let's say, spirited debates it sparked. And ultimately, what could it mean for you listening, whether you might be a patient one day or you're in healthcare, or maybe just curious about how medicine is evolving?
It's compelling, isn't it? Because this isn't just some academic thought experiment. It's a serious attempt to bridge these two worlds, allopathy and Ayurveda, which have, frankly, often operated separately. And that could potentially redefine how we think about health and healing, maybe even globally.
Okay, so let's get into the specifics then. This idea of a hybrid doctor, what does that actually mean? What's the core vision behind this new curriculum?
Well, the program itself, it's slated to kick off in the 2025-26 academic session, and it's meticulously designed, really. The idea is to produce doctors who have genuine expertise in both modern medicine allopathy and ancient Ayurveda.
So a pretty intensive program, I imagine.
Oh, absolutely. We're talking about a comprehensive course spanning over 5 years, and that's followed by a mandatory one-year internship, which is standard, the ultimate goal. By 2030, have graduates emerging with dual degrees. That's the MBBS, the Bachelor of Medicine and Bachelor of Surgery, and the BAMS, the Bachelor of Ayurvedic Medicine and Surgery.
And this wasn't a quiet rollout, was it? It was announced quite publicly.
Not at all. It was announced by the Union Minister of State for Health and Family Welfare and AYUH Pratapro Jadhav. That was back on May 27th, 2025. He announced it during the inauguration of GP Mir's renovated Emergency and Trauma Care Center. So quite a visible launch.
Okay, so blending these two, really distinct medical philosophies, it sounds incredibly complex. What actually goes into the syllabus? How do you even begin to structure that?
It's a huge undertaking. The syllabus for this first phase, it was actually prepared by the Oroville Foundation, and it's based on the National Medical Commission's framework, the NMC's Competency-Based Medical Education, or CBME framework.
CBME, right? So that focuses more on skills and outcomes, doesn't it?
Precisely. It's about what the student can do. So they'll get a really solid foundation in the biomedical sciences, your anatomy, physiology, pharmacology, the standard stuff. But crucially, at the same time, they'll be diving deep into Ayurvedic principles.
What kind of principles are we talking about?
Foundational concepts, like tridosha. That's the theory of the three bodily humors, vata, pitta, kapha, which Ayurveda believes govern our whole physiological and psychological state. Imbalances there are seen as the root of disease. Students will also study Ayurvedic herbal treatments, specific dietary therapies, and panchakarma.
Panchakarma, those are the detoxification therapies, right?
Exactly. Specialized detoxification and rejuvenation practices. So it really is an ambitious dual track. They're aiming for genuine competence, deep competence in both systems.
So for you listening, just try to picture this. Imagine going to a doctor. Let's say you have an infection. They could prescribe the latest antibiotic based on modern tests. But maybe for managing a chronic condition or just for overall wellness, they could also knowledgeably recommend, say, a specific Ayurvedic herbal approach, or maybe some dietary changes rooted in those principles. That's the potential level of care they're aiming for.
That's the vision, yes. A truly integrated approach.
Which leads to the big question, why now? What's the context?
Yeah.
It feels like a very specific moment for India to be making such a significant leap. What's driving this timing?
Well, if you zoom out a bit, you can see how this fits into a larger picture. It aligns perfectly with India's National Education Policy 2020. A key theme there is promoting interdisciplinary and holistic education.
Okay, so part of a broader educational philosophy shift.
Yes. And it's not just an isolated Indian thing either. You see a similar global trend. Countries like China, Germany, They're already integrating various forms of complementary or traditional medicine into their mainstream healthcare system.
Right, traditional Chinese medicine, for instance.
Exactly. And even the World Health Organization, the WHO, has been advocating for this. They encourage incorporating traditional medicine into national health systems, specifically recognizing its potential for chronic conditions, lifestyle diseases, areas where modern medicine sometimes struggles to offer complete solutions.
So it sounds like this wasn't just an overnight decision. India has been building towards this, laying the groundwork for a while.
Absolutely. It's been a process. Since 2022, for instance, the NMC, the National Medical Commission, has mandated that all medical colleges in India must establish departments of integrative medicine research.
Oh, okay, so the research infrastructure was already being put in place.
Precisely. And the standard MBBS foundation course, the very beginning of medical training, now includes an orientation on AYUS systems, AYUS being the umbrella term, Ayurveda, yoga, naturopathy, Unani, Siddha, and homeopathy. Plus, existing medical students can already take electives in Indian systems of medicine.
So GPR's course is really taking that existing integration and pushing it much, much further.
Substantially further, yes. It's moving from just orientation or electives to creating a single, unified academic program designed to produce graduates with genuine dual expertise right from the start.
Okay, let's talk benefits. For someone receiving care, for you listening, what are the real tangible advantages of seeing a doctor trained in both systems?
I think the biggest potential benefit is more comprehensive, more patient-centered care. Let's take an example, say a patient with diabetes. A purely allopathic approach might focus heavily on insulin therapy, medication management, which is vital, of course. But a hybrid doctor could potentially integrate that with, say, specific Ayurvedic dietary recommendations tailored to the individual's constitution, maybe lifestyle changes, perhaps even certain herbal supports shown to help manage blood sugar naturally.
So it's blending the acute management with a more holistic preventative approach.
Exactly. It combines the diagnostic precision and acute care strengths of allopathy with Ayurveda's focus on prevention, lifestyle, and overall well-being. And think about the impact in rural India. Over 60% of the population lives there.
Right, where access can be a huge issue.
Access, affordability, and cultural acceptance. Traditional remedies are often more familiar, trusted, and accessible in rural settings. So these hybrid doctors could potentially bridge a gap, making modern healthcare insights more relatable while respecting and utilizing local traditions. That could lead to significantly better health outcomes for a vast number of people.
And GPMR itself, the institution,
Yeah.
it seems uniquely positioned for this, given its status and scale.
It really is. JPMR is designated as an Institute of National Importance. That's a significant status. They handle a massive volume of patients, over 6,000 outpatients daily, plus 1,800 inpatient beds.
Wow, that's huge.
It is. And their infrastructure is robust. They just renovated their emergency and trauma care center. Plus, there are ambitious plans for an advanced trauma center and an organ transplant center at a place called Siddharpet with a budget of around 846 crore. That shows serious capacity.
And the government is backing this financially.
Fully. The Union government has pledged full financial support. For 2025 alone, 1,450 crore was sanctioned as a grant in aid to GPMR. That signals a very deep commitment to this whole endeavor.
Okay, but like any major change, especially in medicine, it's bound to stir up controversy. This hasn't been universally welcomed, has it?
Yeah.
Where's the main opposition coming from, and what are their arguments?
No, it certainly hasn't been smooth sailing in terms of acceptance, and this really gets to the heart of some fundamental differences in medical philosophy. The Indian Medical Association, the IMA, which represents, something like 400,000 allopathic doctors, they've come out very strongly against it.
What's their main line of argument?
They've actually labeled it mixopathy. That's the term they use. Their core argument is that trying to combine allopathy and Ayurveda could seriously compromise patient safety. They also worry it will dilute the scientific rigor of modern medical education.
Why dilute it? What's the perceived conflict?
Their point is that the two systems operate on fundamentally different methodologies. Allopathy, as you know, relies heavily on evidence-based medicine, standardized protocols, large-scale clinical trials. Ayurveda, on the other hand, emphasizes individualized treatments, a holistic view of the patient, and often draws on knowledge passed down through tradition, which may not always have the same kind of backing from modern, randomized controlled trials.
So it's a clash of epistemologies, really, how we know what works.
In a way, yes. How do you reconcile these seemingly different approaches within a single practitioner, within a single treatment plan, without, as the IMA fears, compromising the standards of one or both? That's their central concern.
And the controversy didn't stop at just the philosophical debate, right? There were issues around how the proposal was developed.
That's true. Things got significantly more heated when a right to information request, an RTI query, revealed something quite surprising. It turned out that the main regulatory bodies, the ones responsible for overseeing medical education, that's the National Medical Commission, NMC, for allopathy, and the National Commission for Indian System of Medicine, NCISM, for Ayurveda and other traditional systems, they were apparently not involved in drafting the initial proposal for this GPMER course.
Really? The regulatory bodies weren't consulted on a new medical degree. That seems odd.
It raised immediate red flags for many, significant concerns about the course's legitimacy. Does it meet established educational standards? Were the proper procedures actually followed? It wasn't just about what was being taught, but how this whole thing came about.
And that lack of initial regulatory involvement, it fueled the opposition.
Absolutely. It gave groups like the IMA and also others like the Telangana Junior Doctors Association, Telangana JDA, concrete grounds to demand that the course be withdrawn, pending proper review and consultation. It added a layer of procedural concern on top of the existing philosophical objections.
But surely there's strong support from the Ayurveda side of things.
Oh, definitely. There's another very vocal side to this debate. Ayurveda practitioners and proponents have largely rallied behind the initiative. For them, integrating Ayurveda into a prestigious institution like GBPMER, alongside MBBS, is seen as a major step towards validating Ayurveda's scientific basis and reinforcing its cultural importance in India.
What evidence do they point to?
They often highlight studies, and there are studies suggesting Ayurveda's effectiveness in managing various chronic conditions, things like arthritis, diabetes management, stress-related disorders, areas where lifestyle and holistic approaches are key. They also make that practical point about rural healthcare.
Right, the trust factor.
Exactly. In many communities, especially rural ones, traditional healers are deeply trusted figures. The argument is that these hybrid doctors could act as a bridge, making modern medical advancements more acceptable by integrating them with familiar, trusted traditional practices. It could make healthcare feel more relatable, less alienating for some populations.
It really encapsulates this wider tension in India, doesn't it? How do you honor and integrate a rich, ancient cultural heritage like Ayurveda with the demands and methods of modern scientific validation? It's a balancing act.
A very delicate one. And the reported lack of transparency certainly hasn't helped ease tensions. There were reports, for instance, that GPNR declined to share specific course details in response to another RTI filed by an activist, Dr. K.V. Babu. When details are scarce, it just fuels more skepticism and debate.
So bringing all these threads together, the vision, the potential benefits, the controversies, the procedural questions, what's really at stake here? What does this mean for the future, not just for GPNR or India, but perhaps for you, listening, and medicine globally?
Well, look, this integrated MBS BAMS course is much more than just another academic program. It's really a test case. Can India successfully harmonize its incredibly diverse medical traditions in a way that's safe, effective, and scientifically sound? If they succeed, it could genuinely set a global precedent. India could emerge as a real leader in integrative medicine.
And the graduates themselves, what role could they play?
They could be crucial in tackling the growing burden of non-communicable, lifestyle-driven diseases. Think diabetes, heart disease, stress. Ayurveda's traditional strengths in diet, lifestyle modification, stress reduction, and prevention could powerfully complement allopathy's strengths in acute care, surgery, and advanced diagnostics.
But the risks are real too, as the critics point out.
Absolutely. If there isn't rigorous ongoing oversight from those key regulatory bodies, the NMC and NCISM, there's a genuine risk the course could falter on academic standards. The IMA's mixopathy concern isn't trivial. There needs to be a very clear framework defining how these two systems interact in practice, ensuring graduates are truly competent in both domains without jeopardizing patient safety. That's paramount.
And public trust is key too, isn't it?
Huge. Ultimately, it hinges on whether patients will trust and accept doctors trained in what might seem like two very different ways of thinking about health. That acceptance needs to be built.
And you mentioned GPRM's broader ambitions. This course isn't happening in isolation, is it? It seems part of a bigger strategy.
Yes, that's quite clear. GPRMR is undergoing significant expansion. They're building a new 470-bed hospital at their Karakal campus, which is near Puducherry. Outpatient services are expected to start there by January 2027. with full operations by June 2027.
Okay, expanding their physical footprint significantly.
And there's more. A proposal for a whole new medical college in Puducherry itself is apparently under review. It signals a real commitment from Duterte not just to maintain its status, but to actively innovate and expand access to healthcare. And importantly, they also have plans for a dedicated center for integrated medicine and research.
Ah, so a research center specifically focused on this integration.
Exactly. It shows they're serious about systematically exploring the synergy between modern and traditional medicine, generating evidence, refining the approach. All these moves together really position Puducherry, with Duterte at its core, as a potential major hub for integrative healthcare research and practice. It's building an ecosystem for this experiment.
So as GPR stands on the verge of launching this really pioneering course, it feels like the eyes of the medical world, certainly within India and perhaps beyond, are focused on Puducherry. We've talked through the bold vision, the potential for truly comprehensive care, the very real debates and concerns from different medical viewpoints, and, well, the enormous stakes involved.
It's definitely a challenging path ahead. It's going to require meticulous oversight, much more transparency than we've perhaps seen so far, and an unwavering commitment to maintaining rigorous standards, both academic and clinical. But, the potential payoff is immense. The possibility of a new generation of doctors who can thoughtfully blend ancient wisdom with modern science, that's a powerful prospect for holistic healthcare.
As we look towards 2030, when the first graduates might emerge, it really makes you wonder, how will this experiment redefine healthcare? Not just in India, but could it influence approaches worldwide? And maybe a final thought for you listening. What role do you think traditional wisdom in its various forms should play in the future of medicine? How do we best integrate the old and the new for better health for everyone?